Hi learners, welcome back to my YouTube channel Psychology Globe. I am Simran and I hope you all are doing well. So today I'm going to talk about a very sensitive yet very important topic. So before we start the video, please like, share and subscribe to my channel and help me reach the goal of 1000 subscribers real quick. So today I'm going to talk about a very tabooed topic which people find very hard to talk about, that is suicide. So suicide is one of the most common causes of deaths these days. According to the NCRB crime report of 2022, there were 1.7 lakh registered cases of suicide. So these are the registered cases. Most of the cases go unregistered because the family members think that it is a shame to die of suicide. So they often term it as heart attack, stroke or any other physical illness. So the main focus of today's video will be that how you as a non-psychologist or a non-mental health expert, how can you identify people who are on the verge of committing suicide, who are having suicidal ideation and suicidal behavior. So today's video will be about identification, and the next video that I'll be posting on this channel will be about the prevention of suicide. So let's start. The very first category of people who are highly vulnerable to committing suicide are the ones who have already tried to commit suicide in the past. So if by any chance their life got saved, there are chances that if they face any crisis in the future, they might succumb to the pressure. So if you know any such people, provide them with the emotional, mental, legal, whatever support they need, and try to make them feel secure. The next category of people that are highly vulnerable to committing suicide are the ones suffering from any mental health condition. So yes, any disorder, anxiety, depression, schizophrenia or any other mental health disorder can become a cause of suicide. Not just mental health conditions but also the physical illness. If a person is in chronic pain and they think that there is no remedy to it, so they might think that ending life is a better option to escape from the pain. Next is feeling lonely or hopeless. If a person is very hopeless, so there are people who have a pessimistic outlook in their life, but if a person is totally guilty about their past, is unhappy with the present, is hopeless in regard to the future, so then there are high chances that the person might think of ending their life because they do not find a purpose in order to exist. So in order to lead a meaningful life, finding a purpose is very important. So in case you find any person who is who thinks that they are purposeless, they don't have any meaning to their existence, so you need to help them. Next is self-harm behavior. If a person is not having the strength to directly commit suicide, they engage in self-harming behavior such as overspeeding in order to cause an accident, drug abuse in order to lead to a situation where a person dies due to overdose. So these self-harming behaviors are also a very clear cut sign that a person might try to commit suicide. The next very important and yet one of the most ignored symptom is when the person actually talks about how the life will be of their family members or friends after they die. For example, if a person gives statement like, you can use my car forever whenever I die, I think I'm going to leave you in a lot of troubles when I die. So what we do is we shun them up that don't talk like this, but you need to dive deeper into their thoughts. Why actually they are making such statements, what kind of emotions are they experiencing, so as they want to make these kind of statements, they are trying to convey you something. So rather than ignoring it, you must try to understand the cause behind it. Next is money, legal or relationship problems. So these causes are very common and most people do suffer from these problems at some point in their life. So if you think that any person is going through any personal or professional crisis, you must provide them help in the form of a mental health professional. You can ask them to go to a mental health professional. Moreover, you can convey to their family or friends to take extra care of them. And to all my viewers who are listening to this video, there is solution for every problem. So rather than trying to succumb to pressure, try to find a solution. Try to write down your problems in a journal. Moreover, the recent short video that I've shared, it is about how to keep yourself mentally stable. So I will provide the link of that short video in this in the description of this video. So do go and watch it. So these were all about the signs and symptoms of suicidal behavior. In the next video, I'll be talking about the prevention of suicide. So till then, take care. Goodbye.